Boy, can fatigue following the treatment of breast cancer be a real problem. I've heard this complaint many times from my patients. Doctor, I'm a year out. I'm 6 months out. I'm 2 years out, 3 years out from the end of my treatment for breast cancer. Why am I still feeling so tired? Why haven't I fully regained my energy level? It's a great question. So how do we go about responding to this? What do I advise my patients? Well, number one is that I want to make sure from my medical oncologist that there isn't some medical reason why fatigue is persistent. Medical reasons could include lingering side effects from the chemotherapy. Frankly, women have more hypothyroidism than men do. So we want to test thyroid function. So we want to do a battery of tests to make sure that physically you're okay. So what else can be contributing then to ongoing fatigue? Well, quite honestly, a diagnosis of depression, a subclinical diagnosis of depression could be contributing significantly to the feelings of fatigue. Fatigue is one of the common complaints with depression. So being evaluated and seen and making sure that you're not dealing with a subclinical or an overt, actually, level of depression is really important. I think if all those things are fine, then things like weight reduction, being heart healthy, and let me follow up now on the heart healthy part of this. We know there's overwhelming data that exercise not only is an antidote for fatigue, but is really important when it comes to surviving breast cancer or, quite frankly, almost any cancer. So the list of things that cause GDOC, I'm tired, which is a common complaint the general practitioners hear. You need to sort through this in an orderly way, make sure the things are not there that I've just previously discussed. And then if all those things turn out really well and you're okay, please start exercising. Exercise is a critical antidote to not only continuing to do well from your breast cancer, but to conquering fatigue. Hi, I'm Dr. Jay Harness, and I want to share with you important information that I believe that every newly diagnosed patient with breast cancer needs to know.
I'm a breast cancer survivor.
I am a breast cancer survivor.
I am a breast cancer survivor.
And I want every woman to know
about personalized breast cancer treatment
and the genomic test.
A test that helps guide a woman and her doctor
to the best treatment options for her.
Pass it on.